Ruthless Compassion is a podcast that shows you how to become fiercely kind. I'm the host, Dr. Marcia Sirota, and in each episode, I get into it with experts and regular folks about the things that get in the way of what we want. Things like addiction and mental health, isolation and loneliness, difficult family and work relationships, and the importance of self-care. I want to help you overcome the obstacles to living your best life, and I want to inspire you to become a powerful kindness warrior. Long before joining the ranks of Toronto plastic surgeons, Dr. Marc DuPere was trained in Montreal at the prestigious McGill University Faculty of Medicine from 1991 to 1996, where he was, notably, mentored by Dr. Bruce Williams, a Canadian and North American pioneer in plastic surgery and a key figure in Dr. DuPéré's choice of vocation and profession. He then attended the world-renowned University of Toronto, where he completed his fellowship of the Royal College of Physicians and Surgeons of Canada in plastic surgery. One of Dr. DuPéré's strong qualities is his warm personality, which helps patients during the emotional process of contemplating a surgical procedure. He is extremely approachable, down-to-earth, reassuring, attentive to detail, and knowledgeable. An avid painter, photographer, and artist, Dr. DuPéré's precision work has attained high levels of refinement and excellence. He is trilingual, speaking French, English, and Portuguese, and brings worldly knowledge to his work each day. It is with a North American training and European refinement that Dr. DuPéré brings a uniquely Atlantic perspective and approach to the practice of aesthetic and plastic surgery. Outside the office, when he is not teaching or presenting at national or international conferences, Dr. DuPéré enjoys spending time with his family outdoors, traveling, gardening, and cooking. I'm delighted to welcome Dr. Marc DuPere to the Ruthless Compassion podcast show today. Good morning, Dr. DuPere.
Good morning, Marcia.
Can I call you Dr. Marc?
Of course.
Okay, wonderful. Well, as the audience probably knows from reading your bio, that you are a plastic surgeon, and I was just wondering how you came to choose this particular specialty in medicine.
I will try to make this a short story, but many years ago when I was in medical school, it was clear to me that I wanted to be a surgeon. I am a very manual person. I've always done a lot of art on the side. I'm a gardener. I paint, I draw. So for the longest time, I knew that working in a surgical suite was for me. There is a sense of peace when we're in the surgical center, in the surgical room. Now, over the years, then I explored which specialties I would be interested in, and I got quickly attracted to plastic surgery for both the aesthetic but also the reconstructive side. I enjoyed very much changing people's lives, changing functions, as in reconstructive surgery, but also changing the look or changing things that may have bothered that person in particular. And one other big reason for me choosing plastic surgery was the fact that plastic surgeons are the only surgeons who work on every single part of the body. So I can assure you that there are no boring days in my working life.
I can imagine. It would be very interesting. What kind of people walk into your office?
We have many or all kinds of people. We have young people, we have old people. I would say the range can be between 18 years old, and I've got a few grandpas and grandmas in their early 80s who come for little beauty treatments. We have males and females, especially in my downtown location. Males will probably represent about 17-18% of my practice, whereas 80-82% will be females. We get the students, we get the artists, we get the Bay Street lawyers, we get the bodybuilders, we get the mummies who've had kids who desire to restore their bodies. So we see every kind of people today. It's no longer just for the celebrities and the Hollywood people. It's for every Mr. and Mrs. Smith.
And do people have different reasons for wanting to come to see you?
Yeah. I always explore those. It's very important for me to understand why somebody wants an aesthetic procedure from me. Many are very reasonable expectation, reasonable requests. They've had, as I said earlier, they've had a couple of kids, the body has changed, and they would like to restore their pre-baby bodies. Some people feel they look older. Some people feel they've lost the competitive edge in their work and they want to look better, to look their best. And this is a very common request for us. Fortunately, most people do it for themselves and not for others. So it's very important for me to know. There's no doubt that it does not bring back a husband. It does not bring back a wife, that kind of stuff. But most people who come to see us want just to do something to look better or to look their best. But that varies also, and I think it's an important point. It varies amongst culture. In North America, especially in Canada, we're in between what the European people want and the American people want. In Europe, they want to look their best. They want to look pretty. Whereas if you go to places like Asia, where especially in Korea, where it's a very, 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 very important. Plastic surgery is a very common procedure. They want to look different. They want to look more pretty. They want to look more beautiful. If you go to Latin countries, Brazil, Costa Rica, even Mexico, Latin people want to look sexy. And those have all been studied across, and I just returned from a big international meeting in England, and we went through all the different cultures, and we all know Toronto has all those cultures, and I will see those small differences when I see my patients.
That's very interesting. So people have different motivations. What about people who have maybe more troubled psychological motivations? Do those people walk in your door?
Yes. I see it as a spectrum. I think we all have a little narcissistic side. That's why we put makeup when we go to work. We put a tie and a suit for guys. We do our hair. Ladies will do their nails. Some guys do their nails too. So there is a healthy dose of, loving yourself. And I think we all should have a little bit of it. And I see it as a spectrum. There are ladies who will not color their hair and they're happily will get older with salt and pepper hair. But a lot of others like to color them. And I see what I do in my life as a spectrum from what I just mentioned, the hair, the nail, the makeup, into the next stage, which might be skincare, could be laser, could be Botox and fillers, all the way up to the surgical ladder of rejuvenation, which, we can talk about upper lid surgery, breast, etc. Now, there are people a small group that will have truly not reasonable expectations. Some people will clearly mention that for a small issue, like a tiny little scar, that it's impeding on their lives and they cannot function and they cannot go to work and they cannot see themselves in the mirror. And there is a very small group of people who suffer from what we call dysmorphic body disorder, which basically is a condition where people see something in the mirror that nobody else sees. They see themselves as a lot worse than what their partner will see and what the doctor will see. And this is something that we have to be aware of because it has a deeper meaning. It has a deeper problem, which needs to be dealt with before the plastic surgeon decides to do something on that patient. It is a small group, and again, that spectrum of beautification is wide, and there are gray zones, and in plastic surgery we see them. And we have to kind of maneuver and navigate through this with the patient.
I can imagine. And have you had patients who've come and you didn't know in advance, they seemed pretty ordinary like all your other patients, and then after you did the procedure, they were very disappointed and you thought it was a good outcome, but they were not happy?
It doesn't happen often, but of course, like any plastic surgeon, I have a very busy practice. I've been in practice for 15 years. And as plastic as surgeons, we don't spend a lot of time with our patients. So I will classically and routinely meet my patient twice, usually about 30 minutes every consultation. They're more than welcome to come more often, but routinely twice before a surgery. So within that amount of time, I do get a history like any good doctor. We go over the patient's request. I go over their options. I go over their expectations. But I only can work with what the patient tells me. And I don't always know what's happening at home. And some patients may not tell me all the truth. I may not ask always the right questions to know. So once in a while, we may be missing the real reason or an issue that the patient may have. So yes, occasionally patients come back and I may be fully happy with the results, and we do grade our results like anybody else. I mean, we do a good job. Sometimes we wish we'd have done something differently. And once in a while we do meet patients where despite the excellent results, she may not be happy.
Mm-hmm. I guess beauty is a very subjective thing for people.
Mm-hmm.
What to you, what is beauty? What do you see as beauty being?
Beauty for me, if I go from at the beginning, is really a beautiful smile and some sparkling eyes. This is what to me is beauty. Is the bubbly personality of a person. And anything around this after is what I work with. But beauty to me will be someone who's happy about him or herself, someone who smiles, someone who's bubbly. Now, the other types of beauty that we talk all the time in my work will be more specific. Like we talk about lips, we talk about cheeks, we talk about proportions, we talk about angles, we talk about, excessive skin, hooding, looking tired, looking like someone has chicken neck or turkey necks. So when we get into my plastic surgical world, then we have definitions. The definitions are present, but I use them with caution. I do value cultural changes and cultural differences, and I think not everybody should have a Parisian nose. For the same reason, not everybody should have the same body shape, the same buttocks, the same breast. And again, cultural variation is very, very important. And Toronto has, again, a strong cultural background. So beauty for me encompasses all of those features.
So very much inner beauty as well as the outer features that people are looking for.
I think, yes. I think we've all been in front of what we and the society and the media and all the magazine consider the most beautiful people. But if she or he is beautiful and we start talking to that person and the personality does not come with it, I think that person loses some beauty.
I agree with you. Why do you think beauty is so important in society?
Well, it's been important all along. You go back as far as history can bring you in books and in pictures like the Egyptians, the Greeks, the Roman, the Syrian. All those cultures over millennia have always put emphasis on beauty. Beauty probably goes back all the way to what mammals were designed for, was to mate, and procreate. And attractiveness, I think, is meant for that, to find a partner in your life and to move on and have procreate and continue. And I think that goes back to our first instinct as mammals and human beings. And feeling attractive, pretty, I think is good for the self-esteem. It's good to get your friends, your family. And again, I think this is all part of history for us.
Do you think that being attractive is part of being your best self and living your best life?
I wouldn't say that one always is important for the other one, but I can say that for many, many, many people, feeling attractive inside will influence their daily life. And I just take simple example. When I'm not sure how to answer a question like this one, for example, I know personally, if I look sloppy on the weekend, my hair's not done, and I'm just wearing sloppy clothes, I may still feel good if I'm going to garden, for example. But I know when I wear a suit, a tie, my hair is done, I kind of look nice. I feel good about it. I look at myself in the mirror and I'm kind of happy with the way I look today. I will bring a smile with me. I will communicate this kind of feeling of self-esteem and confidence to people. And I think people see it. And I think a smile and confidence can be contagious. And I think it brings this into the people we are surrounded by.
That's interesting. Do you think that people sometimes use their attractiveness to compensate for something that they feel is lacking on the inside? Like they focus their attention on being more attractive because they don't feel good enough?
Of course. We all have little issues, all of us. We all wish we had a different nose, a different ear, different hair color, different skin color. So we all have, to some extent, little things. If we're short, we want to be tall. If we're tall, we want to be short. There is a human part to it, which we all have, and most of us deal with it. We accept it. We acknowledge it. But there are people who truly may be depressed, may have some issues at home, and we can talk about, marital issues. They can have undue stress. It might be some sickness in the family. And that sometime, instead of dealing with this, they will look for something else that's a little bit easier to manage. And that can be a cosmetic procedure in order to defocus, to remove the focus out of something that's happening at home or at work. And they start focusing on this. And it's a good point you're mentioning this, because all along plastic surgeons were trained to, we know it's not a good thing to do a big cosmetic procedure on somebody who's going through a stress at home or at work. Surgery is a stress on its own. People will, look bruised and swollen and stitches. And for a couple of weeks, 2-3 weeks, sometimes for larger facial procedure, there will be some downtime. There will be some time when somebody looks at him or herself in the mirror and feel, oh my God, what have I done? Now, if the person is happy in her life, in his life, at that particular time, if the patient has been prepared properly by the surgical team, the surgeon and the nurses, usually they go through that period of time nicely and smoothly. However, if there are stresses at home, a divorce, a recent move, a disease, a child who's sick, usually that compounds with the stress of surgery, and that usually makes the recovery a lot harder.
So obviously it's not a good idea to make big life choices when you're under stress, but you have seen people who are feeling, like you said, depressed or inadequate or perhaps not lovable, and who think that if they change their facial features or their body, then they will feel better about themselves.
Yes. Yeah, it's relatively common. And it's important for me to navigate, because this is an expectation the patient has. And funny enough, many patients ask me, Doctor, will I be happy? And, I have to answer this very carefully, because I cannot promise happiness. Happiness, as everybody knows, has a lot of dimensions. I can promise things like, the excess of skin under the neck will be removed. It's going to be a nice, younger angle. I can promise the excessive skin will be removed. So the tiredness, the aging part of the eyelids will be improved. I can promise to a lady who wants a breast lift that her nipple will be lifted in a more youthful position. But I cannot promise happiness. I cannot promise that they will get their job back. They will get their husbands back, obviously. So I have to tell the patient carefully that what we're doing here is to restore things to a more youthful, to a younger look. We improve, we make things look better, but we cannot promise happiness. Happiness is inside. Now, if somebody looks younger, happier, if with my little Botox needle, for example, I can turn the corners of her mouth up in a smiling position, if I can raise her eyebrows in a more youthful, happy look, if I can replenish the lost volume over the lower lids, the tear trough as we call it, and the patient looks more youthful, younger, there is a high likelihood that she will have positive reaction from the people around. I hear this every day, and those are the best rewards for me when somebody says, wow, you've all thought I was back from a 2-week vacation. I look rested. I look younger. I look fresher. Those are the terms I like to hear from my patient that they've heard from others. And I think that if I get to work and I'm having a bad morning and somebody says, wow, Dr. Marc, you look great today. What have you done? Like something changed. Well, that often switches the mood of somebody. And yes, for that particular time, the person who was given the compliment will feel better about himself or herself. So I think in that way, if people get compliments, if somebody is being told, wow, you look so sexy, then I think this will help patients to kind of feel happier and have some confidence and a better self-esteem.
So really what you're saying is that if you're feeling okay about yourself, then making those little adjustments will improve you on a day-to-day level. But if you're feeling really insecure, really inadequate, really depressed, there's no surgical treatment for something that deeply emotional.
That's correct. You know, we work with superficial things, and I'm referring to both. I'm playing with the word now, like plastic surgery works with superficiality, but we also deal with, skin and muscles and fatty layers. Now, we're not dealing with the inside of the patient. All of this is psychology and psychiatry and the way the ego is and how we feel. And Marsha, you know more about this than I do. But, I can only help with the surface. And we like to make things look better, fresher, younger. But if there's a deep inner feeling of depression or a deep inner feeling of not looking and feeling attractive, there's a big chance that despite all the magic I can work with my needles and my sutures, there's a big chance that we may not be able to change this and that the patient may need a different type of help.
Right, the kind of help that really treats their inner issues.
Yes.
I want to go back to youth because you talk a lot about younger. And I'm thinking about somebody who might have been a very attractive person in their youth, and they become very attached to their identity as an attractive person. And then as they get older, as the normal aging process goes, they might start to feel less and less attractive. But their identity is really bound up in being beautiful or handsome. Mm-hmm. And then once they're aging, they're kind of having this identity crisis because they're not the person who they thought they were. Is this something that you encounter a lot, that people are very attached to their identity as being very attractive?
I think there's a small subgroup, and it's being portrayed all the time on the magazine in Hollywood. And I think we've all seen exaggerated lips and exaggerated cheeks. Fortunately, we don't see so much here in Canada. We're a bit more conservative society, but still there are some people. And I see the people who are very, very social, the models, people who are often exposed in the society. Some of them want to maintain this forever. And obviously it's not feasible. Aging cannot be stopped. We can only delay it a little bit or make things look a bit better. So there is a subgroup of people who may not accept the aging process. And this is all, again, back to expectation. When they come to see us, this is something we have to discuss with the patient and remind them that the fountain of youth has not been fully found yet. We can just help improve, look a bit fresher and younger.
So really what you're saying is that what you have to offer is making these, like you said, superficial adjustments to help a person feel a little bit better about themselves and within society to present themselves in a fresher way, but that plastic surgery is not going to stop the aging process. It's not going to cure depression. It's not going to overcome a sense of inadequacy. It's not going to change their inner functioning?
Well, I cannot promise those to a patient, but yesterday I was preparing for this interview with you, and I have a patient, for example, very small. She's been my patient for 3-4 years. She is a young lady in her late 30s, very pretty, very attractive. And she knows it. She has no inner issues. She knows she's attractive. She's married with kids, successful at work. But she has an asymmetric, non-symmetrical smile. And the mouth has many, many muscles that pull up, side, and down, which helps to talk, to kiss, eat, etc. She has an asymmetrical smile, and I see this a lot. I mean, the two sides of our faces are sisters. They're not twins. And I remind everybody of that the two sides are not exactly the same. But she has a very noticeable pull on one side of her lip, which means that side is stronger than the other one. And when she smiles, and she smiles a lot, she's a very happy young lady. When she smiles, it accentuates the crookedness, the asymmetrical smile. And it bothered her a lot. And the more, as she got older, more and more people were asking what was the problem with her lip. And she mentioned names of famous people, our the second previous prime minister who had a facial palsy. And for her, it annoyed her. It did not prevent her from working. It did not prevent her from getting married and being happy. And this is very common. But we met a few years ago. I corrected that asymmetry with 5 units of Botox. It's a mini dose into one of her muscles that was pulling too hard. And her smile is restored. I see her every 4 months for this. It's not costly at all. 5 units, it's a few dollars. And it made a huge change in her life. Without me prompting her yesterday, she told me, she says, Dr. Marc, and a lot of patients call me Dr. Marc. She said, Dr. Marc, my life has changed. People don't look at me in a funny way. People don't ask me about my weird looking smile. I have moved forward and I don't have to think about it anymore. I don't have to adjust my lipstick anymore. And this is a minor little thing, but I see this every week where I do little things to people and it changed their life completely. And with the same reason as you were talking about earlier, sometimes we do big things with great results and it may not change the patient the way she was expecting.
It's a really interesting interplay between the person's internal expectations and internal feelings and the kind of things that you can do. It sounds like there's a lot that you can do, but then on the other hand, there are certain things that you just can't do. And then each person is a different individual with different needs, different feelings, and different results.
Mm-hmm. Of course, it's not like an appendix that's hurting. You remove it and it's gone. Self-image, self-confidence is only partly what you see in the mirror. There's a big inner component to it. You know, I go to Brazil a lot. Brazil is a big country with strong plastic surgery. But funny enough, when I go to the beach, I will see lots of very overweight people with tiny little bikinis, and they're very happy in their body. Whereas you would take a North American guy or girl, and we all tend to feel very self-conscious about a little love handle. So there is a lot of how we see each other, how we see each other in the mirror, how we think people see us, and how we behave in life, how we behave in the society, how we behave at work, how we behave on the beach. So there's a big component inside.
So what you're saying is that in every society, there are different expectations and different pressures. And it sounds like what you're saying is here in North America, there's a lot of pressure to have a perfect look, to be very slender and to look like the models on TV and in the papers.
Yeah. And it's also, as we all know today, the media and all those magazines, and all of us have seen some of those celebrities in real life. And we all know that those pictures have been retouched. photoshopped. Light is different. We've all had professional photos taken of us at some point in our lives, and yes, they can work magic on Photoshops. So we have to be careful, and I see this even more importantly with our teenagers, where they have to be reminded that those pictures are fabricated. Yes, they start with a model, they start with maybe some sort of good substance, but no one looks perfect like we see on magazines. So we have to be careful, especially with our teenagers, where when the self-esteem is being kind of matured.
I guess, yeah, when our personalities are being formed,
Yeah.
we have to have people helping us have realistic expectations about our looks and not go overboard with our expectations and not think that we have to look like these photoshopped images.
Correct.
Do you think that there is a kind of a problem with that in society, where there's too much pressure to conform to a certain standard?
I think there is. I would like to say that there's none. The pressure is growing. With the social media being so important today, the selfies, the Instagram, the Facebook, I think the pressure is getting stronger. It has a dangerous side to it, because some people may wish to find the easy way. Another example is if after the holidays we feel a bit overweight, and instead of going to the gym and trying to lose those 5-10 pounds that we gained, instead of going to the gym, may look into liposuction. Obviously, it's the wrong way to do. I personally prefer a patient who's been going back to the gym, has been trying to lose weight, has had a better diet, but there is an area that's resistant, that will not go away. And then we can help them to get that final touch. But today, there is a strong pressure in the society. It's very competitive. The working place is competitive. I think bigger cities like Toronto has more competitiveness, and it has brought a lot of patients in our offices for that matter, for that reason. They want to look their best.
I think they want to look their best, but they also want to look like a certain standard, which might not be realistic for the majority of the population.
That's correct. That's correct. But the standards are also different depending on the cultures. But you're right. There are expectations, and patients commonly will ask us or bring pictures of what they would look like, they would like to look like.
If you had a call to action for people who are thinking of coming to see you or just listening to this broadcast, what would be your call to action with regard to what we've discussed today?
Well, I think what we like to see are patients who are happy with themselves, and they want just to look a bit better. They want to look fresher. They want to improve something that they feel that they've lost, and they want us to help them to return maybe 5 or 10 years ago with their body, with their facial expressions, with their wrinkles. We want people who are happy inside, and they just need that little extra in their life to kind of make them feel good about themselves and to restore some confidence and self-esteem.
So really what I'm hearing you saying is that you want people to work on themselves so that they can be happy, and when they come to you, not expect you to dramatically change their lives or change their sense of identity, but just, freshen themselves up a little bit. Use plastic surgery like you would use any other aesthetic support, aesthetic help, or grooming kind of thing, as opposed to trying to fix some deeper inner problem. Is that correct?
This is 100% correct.
That sounds like a very good call to action. Dr. Marc, where could people find you if they're looking for you online and in terms of your professional practice?
So we have 2 offices. The headquarters, what we call our flagship surgical center, is in Yorkville, Toronto, at 133 Hazelton. This is where I see the bulk of my practice, and this is where we're performing our plastic surgical procedures. I also have a satellite office in Richmond Hill where I see people in consultation, follow-ups, and I will also do all my injectables. Our website is www.visageclinic.com, VISAGE clinic.com, and our phone number is 416-929-9800.
Thank you so much, Dr. Marc, for talking with me today. It was really, really interesting, and I especially liked the idea of how people can use plastic surgery in a healthy way to sort of boost their appearance as opposed to trying to compensate for something missing on the inside. I think that's a really important point that you made, and I think it's a good way to leave our conversation.
Thank you very much.
It's been a pleasure, Dr. Marc. Take care.
Have a good day.
You too. Bye-bye.
Bye-bye.
That was the fascinating Dr. Marc DuPere, and I'm Dr. Marcia Sirota. If you like this podcast, please review it on iTunes. You can also sponsor me on Patreon at patreon.com/Dr. Marcia Sirota. And please sign up for my monthly newsletter at marciasirotamd.com.